Welcome to our special coverage of COVID-19. I'm Min Sun-hee. The total number of infections across the globe stands at more than 15 million now. Meanwhile, here in Korea, a cluster infection at a frontline unit in Pocheon is sounding the alarm as at least 13 soldiers have tested positive for the virus. We begin now with more on the latest figures with our Kwon So-ah and related news with our Kim Ji-yeon. So Korea is seeing a surge in cases on this Wednesday here.
Yes, and that is, as you just mentioned, because we also have 13 Army soldiers confirmed with the virus at a frontline unit in Pocheon County in Gyeonggi Province. And after 2 initially tested positive on Tuesday, we will have to wait for more test results to come out from that unit. Meanwhile, we have a total of 63 new cases today, 1 additional fatality, and 7 more people in quarantine or treatment, and 55 new recoveries. That brings the recoveries to almost 12,700. Now, according to the KCDC's earlier briefing this morning, numbers are expected to repeat the recent pattern of increases and decreases while we are on an increased trend in the past 2 days. Now, let's move over to our map. We have 36 new cases in the metropolitan region alone, and 28 of these were local infections. Also, 4 new cases in the southwestern city of Gwangju, and 19 cases were detected during screening procedures at the country's airports and seaports.
Right. So as I mentioned at the start of the program, the global tally of COVID-19 cases has surpassed 15 million.
Yes, that's correct. And as of noon Korea time, if we take a look, that number is nearing 15.1 million, as some 240,000 new cases have been added in just a day. And we also have almost 620,000 fatalities and 9.1 million recoveries around the world. Now, meanwhile, with the U.S. having surpassed 4 million cases, U.S. President Donald Trump acknowledged the situation will probably get worse. And in fact, that's also seen in the surging death toll. 1,000 cases, more than 1,000 have been added on Tuesday local time alone. That's the first time that happened in July. Meanwhile, these top three countries here are seeing tens of thousands new cases on a daily basis. Let's move over to our next chart here. Mexico, almost 356,000 new cases, and Iran also approaching 279,000 with more than 2,600 new transmissions. Now, that's the updates I have for now, but I'll be back after the government briefing. Sunny?
Right, so I'll see you back at the desk. COVID-19 has affected South Korea's joint military drills with the U.S., fueling uncertainties surrounding the transfer of wartime operational control from Washington to Seoul. The Navy, for its part, though, is scheduled to take part in a U.S.-led maritime drill next month to mark its first multinational exercise since the start of the pandemic. For more on that, I have our Defense Ministry correspondent Kim Ji-yeon here in the studio with me. Welcome, Ji-yeon.
Glad to be back.
Right, Ji-yeon, now do tell us more about this upcoming maritime drill. But first, let's begin with the infections in the military.
Right. Seoul's Defense Ministry confirmed this afternoon that the number of confirmed cases in the military has climbed from 0 to 13, the first uptick in cases in 20 days since the last remaining patient recovered from treatment. The soldiers who have tested positive for the virus were all from a unit in Pocheon, as you mentioned, just north of Seoul. We'll have to see if there are more infections, as test results of the entire unit are yet to be released. It just shows that the military can't let its guard down when it comes to the spread of COVID-19. Regardless, the Navy has sent 2 destroyers and some 570 troops to Hawaii last Saturday to participate in the biannual Rim of the Pacific, or RIMPAC, exercise. It's to take place for 15 days starting August 17th. It's the world's largest maritime exercise, and as you mentioned, happens to be the South Korean military's first participation in a multinational exercise since the outbreak. The exercise is vital in strengthening the operational capability of combined forces and the ability to carry out a joint response to various security challenges that may arise in the Pacific Ocean. Some of the exercises include blocking waterways as well as anti-submarine warfare drills. And this year's exercise is particularly notable as South Korean Navy Captain Kim Sung-wan will serve as the combined task force commander leading the multinational fleet.
Well, that is good to know, Cheon. It's good to see that these events are going ahead as planned, as much uncertainty had surrounded them amid the pandemic.
Right. Although the RIMPAC exercise is being carried out, its usual activities are affected. And I have to tell you, for instance, the Navy this year is sending a 7,600-ton Aegis destroyer and a 4,400-ton destroyer. But that's scaled down from 2018 when South Korea had sent a submarine patrol aircraft and some 700 troops with its destroyers. That's compared to 570 troops this year. Also, due to the pandemic, land and shore-based training as well as social events that usually take place on shore among the participating troops will not be held this year. And only 10 countries are participating this year. That's compared to 20 countries in 2018.
Right, and I'm sure all the participants will be extra careful because the spread in the military could be particularly damaging, of course.
That's right. The South Korean Navy has making sure that that doesn't happen. And I talked to a Navy official about this, so let's take a listen.
All of the troops taking part in the exercise have tested negative for the virus and have been staying inside the vessels for 2 weeks before departure. All of the troops are being provided with face masks, hand sanitizers, while protective gear and medical supplies are being supplied in case of symptomatic patients arise during the exercise.
Emergency response measures in case of a spread includes immediate quarantine of suspected patients, followed by prompt testing with diagnostic kits. When someone's tested positive for the virus, he or she will be airlifted via helicopter to a U.S. hospital for treatment, and the Navy is to withdraw from the exercise for early return.
Well, that sounds reasonable. But as you mentioned, conducting military drills on the peninsula this time around could be extra difficult because of the pandemic.
Right. The defense ministers of South Korea and the U.S. talked about in their phone conversation held Tuesday and discussed the issue of concerning the two countries' combined military drill that is to be held in mid-August. And the number of incoming military personnel from the U.S. mainland and from overseas to take part in the upcoming drills on the peninsula is undecided amid travel restrictions placed by the U.S. Department of Defense. The number of participating troops is an important factor in setting up the whole operation for the upcoming exercise scheduled to take place in mid-August. And the incoming personnel have to, of course, undergo a 2-week self-quarantine upon arrival in South Korea that could put on hold U.S. plans for other operations in its mainland or overseas.
Right. Now, apart from that, I understand that the nature of next month's drill is different from that of the naval drills you spoke about earlier because they could raise the possibility of infection. Please explain.
Right. The upcoming drill concerning the U.S. and South Korea is a computer-based simulation exercise, where like hundreds of people occupy a seat in an underground bunker. So you can see how that could be more susceptible to the virus. And they do it on a rotational basis for at least 12 hours a day for about 2 weeks. It's an environment that no one wants to be in this pandemic. And when compared to the maritime exercise where troops stay on their own vessels, while the exercise is conducted out in the open sea, you can see how there's a difference in the two exercises. By canceling the simulation exercise could have an impact on the transfer of wartime operational control from Washington to Seoul, since it could hinder its ability to carry out a performance capability or evaluation of its full operational capability during the latter half of this year. It's the second major step in the 3-step process to ensure the conditions-based OPCON transfer, in which the Korean 4-star general would lead the future combined Forces Command, replacing the USled CFC. And earlier this year, the two countries had already postponed their combined military drill this year, so this drill is important as ever.
I see, it has to go on then.
Yes.
All right, Cheon, thank you very much for that report.
It's been a pleasure.
Right, it's time now for the regular government briefing on COVID-19 here in Korea. As mentioned earlier, a cluster infection at a frontline unit in Pocheon is raising concerns. 2 soldiers tested positive for the virus on Tuesday, and tests on the entire 220-member unit have so far revealed that 11 more have been infected as of Wednesday noon. Officials believe that number of confirmed cases may rise as test results, that is, of the other soldiers are pending. The unit itself has has gone into quarantine. Meanwhile, those arriving in the country infected with the virus may soon be asked to pay part of their medical expenses in the future. Now, this possibility was raised during a regular closed-door briefing amid concerns of the expected financial strain on the local medical sector should imported cases continue to challenge containment efforts here. Now, we also have news that the current regulations show the government covers all the treatment and testing costs for confirmed patients, regardless of the nationality. Treatment costs for a COVID-19 patient could range from 3.3 million to 70 million won, depending on the severity of the symptoms. As of June 26th, imported cases account for almost 60% of the total infections here in Korea. Also, health authorities are sounding the alarm, that is, but we'll have to come back to you later on that because the briefing is about to start. I'll come back to you with the summary with our Kwon-Soo-wa.
Let us now begin our regular briefing on the COVID-19 situation. As of July 22nd, we have a total of 29 new local infections and 34 new imported cases. The total number of confirmed cases now stands at 13,879. 55 more people have been discharged following full recovery, and the recovery rate stands at 91.5%, while 884 people are in quarantine. For those in severe and clinical conditions are 21, and we have additional of 1 fatality, and the death toll now stands at 297. The fatality rate is 2.14%. I extend my deepest condolences to the deceased and the members of the bereaved family. Here are some updates on our major domestic infections. In relation to a central daycare center in the Gangseogu district, Seoul City, we have 3 facility users being confirmed, and in total we have 15 cases being confirmed. 12 of them are facility users and 3 of them were family members. And in relation to a K building in Gangnam-gu district, Seoul City, we have in relation to a real estate company, we had on the 21st of July, the first index case being confirmed, and a total of 13 have been confirmed to date. 9 of them are employees and 4 of them are their family members. And in relation to Sarang Church in Songpa-gu district, Seoul City, we have confirmed that 3 additional cases have been confirmed, and a total of 4 people who are worshippers at this church have tested positive. And next, regarding a frontline unit in Pocheon County in Gyeonggi Province, we have a total of 13 cases, and we are conducting our investigation, and we are also doing the investigation tracing. And yesterday, we had a total of 34 new imported cases, and at the point of entry, 19 have been confirmed, while the rest of the 15 were reported while they were on self-quarantine. And 15 of them are South Koreans, while 19 were foreigners. And 5 of them from US, 1 from Turkey, 11 from Uzbekistan, and also 4 from Kazakhstan and 1 from Indonesia and Iraq, respectively. And the KCDC is cooperating closely with the Defense Ministry to curb the further spread of the COVID-19 through the influx of imported cases as well as community spread. And we have been conducting the testings for all of the new entrants to the military. And during the past 8 weeks, we have conducted the testings for over 40,000 new entrants of the military, and we have confirmed 1 case being positive, with the rest of them all testing negative for the virus. And this test was carried out in order to curb the further spread of the virus, so that our military officials and military soldiers could also be in a safe environment. And during the next 8 months, we will continue to extend the testings as well, and we will also expand the subject of the testings, not only to our regular soldiers but also to other military officials as well. And we together we will also test all of the youths here in the country, and we will also conduct and we will also stay vigilant, and especially we have reopened the social welfare services, and we also ask for the people who are working there to take extra precautions, and we ask the staff members there to frequently disinfect the frequently touched areas, including the wheelchairs as well as other handles and doorknobs, and please refrain from engaging in activities that increase the travel of respiratory droplets like singing or chanting, and please also sit in one row when dining together, and please ventilate the space on a regular basis. And we also ask the users the following: if you have any suspicious symptoms, we ask you to refrain from going to these facilities and get tested as soon as possible, and refrain from going to multi-use facilities like PC rooms, singing rooms, and also clubs as well, and also refrain from going to social group meetings. And while you are at the facility, please wear your face mask and wash your hands and abide by strict quarantine measures. And the next following measures are asked for the users. If you have symptoms of fever or respiratory symptoms, please get tested as soon as possible. When you are using the facilities, please wear face masks and also keep 2 meters of healthy distance and wash your hands on a regular basis. And during the upcoming summer holidays, we ask you to follow by our infection prevention guidelines for wise holiday spending. If you have symptoms such as fever, cough, or nasal congestion or sore throat, please refrain from going outside. And also we advise you to keep with your immediate family members only. And please avoid popular and crowded locations and busy hours, and utilize your own personal vehicle if possible. And even at the local destinations, please keep a 2-meter distance and wash your hands, and please avoid any crowded, confined, and closed spaces like cafes and restaurants, and always wear your face mask at all times. We are seeing a continued occurrence of COVID-19 infections here in the local community. As we said, the COVID-19 spreads very fast, and it is very highly infectious, and most of the cases are asymptomatic, meaning that it is difficult for us to track and to diagnose the patients at an early stage. And we have confirmed that in a small group, there were also many cases where all of the people, up to 10 people within a group, including family and colleagues and business establishments, increased, and we had such occasions of outbreak. And especially for the high-risk groups, we are also seeing that it is very vulnerable for the high-risk group, including the elderly citizens. And the fatality rate stands at 2.14%. However, this increases to about 9.5% and about over 20% over the age of 70 and 80 respectively. And it means that 1 out of 10 people could die from the disease if they are in their 70s, and 2 out of 10 people could die if they are in the age of 80s. And also, therefore, we ask the nursing hospitals as well as long-term care centers to take particular precautions, and please ventilate the space on a regular basis and refrain from engaging in activities that increase the travel of respiratory droplets, and keep 2 meters of distance, and please abide strictly by our quarantine protocols. In addition, all of the health conditions of all of the users and patients need to be checked on a regular basis, and you also need to let them be tested as soon as possible if they show symptoms. Thank you very much.
Right, there was our Chung Young, the head of the KCDC, with Wednesday's afternoon briefing. So, do give us a summary of the key announcements.
All right, well, we talked about the infection at a military unit in Pocheon County in Gyeonggi Province. It looks like the number stays at 13 as of this afternoon. People that had been tested, 11 people who had close contact with 2 military men earlier have been confirmed this Wednesday. And this unit is a 220-strong unit, so still there are being tests conducted, so we will have further information later, I believe. But it looks like now 71 accumulated cases in the military have been reported here in the country. Meanwhile, Chung also mentioned that there have been 34 imported cases today, with 15 being South Korean nationals and 19 foreigners. And recently there have been more and more cases related to facilities where a lot of elderly people are at. That's why these facilities should be checked up more thoroughly and also disinfected. And this is also why Chung mentioned how the fatality rate among people aged 70 is really high. 1 person out of 10 people, 10 patients die. And when it comes to people aged 80 and above, 1 out of 4 people die from the condition. So that's an issue we have to still keep an eye on.
Right, so thank you for that. We'll see you again tomorrow.
Thank you. See you tomorrow.
Right, a recent survey of 522 individuals, that is, in the arts and culture industry shows 41% of the respondents are worried about their livelihoods amid the pandemic. Against this backdrop, there appear to be some efforts here on the local front to ease the plights of these artists by offering them platforms to perform on. Do take a look.
Korea's arts and culture scene has taken a battering due to COVID-19, with new job opportunities in the performing arts sector becoming all but non-existent. The situation appears to be worsening with the COVID-19 pandemic showing no signs of abating. Fortunately, both central and regional governments, as well as businesses, have rolled out a bevy of supportive measures for struggling artists. To help artists who are out of work get back on stage, the Gyeonggi Culture Art Center started the GGAC online broadcasting station, which provides performance opportunities and video content production for artists in need. Artists are paid for their performances, which are streamed live by the Gyeonggi Culture Art Center via their YouTube channel.
나라 대 나라, 사람 대 사람, 예술인과 관객이라는 이런 소통을 할 수 있는 거를 코로나19로 인해 좀 힘들어진 상황에서도 온라인을 통해서 더 하지 못하던 부분을 이렇게 할 수 있다라는 거에 대해서 좋게 생각해가지고 저희도 기쁘게 참여하게 되었습니다.
This is a concert hall located in the city of Pucheon, Gyeonggi-do Province, west of Seoul, where another performance is being streamed on the GGAC online broadcasting station. The first act is a dance performance by Jinjo Crew, a b-boy team that lights up the stage with their flashy dance moves. Jinjo Crew is the world's first team to win the b-boy Grand Slam and has played an influential role in the selection of breakdancing as an Olympic sporting event, which will debut in the 2024 Paris Summer Games. Jinjo Crew is one of the world's most decorated b-boy teams for a reason. The GGAC online broadcasting station features collaborative performances between artists from all walks of life. During its first season on air, the GGAC online broadcasting station generated more than $750,000 in revenues for the performing artists and has created around 1,000 jobs.
경기도 전역에 7개 거점을 설정해서 총 400개 단체를 만나뵐 예정에 있고요. 추정하기로는 1,600인 정도의 예술인들께 저희가 일자리 제공 정책에 맞춰서 그런 어떤 지원 사업을 진행할 수 있을 거라고 판단하고 있습니다.
이런 기회가 자주 있어서 코로나19의 이런 상황에서 조금이나마 서로의 위안이 됐으면 감사하겠습니다.
문화 활동적인 게 더 다양해져서 더 많이 즐길 수 있는 무대가 많았으면 더 좋겠습니다.
The performing arts sector needs support of its audience more than ever, but artists are finding their way back on stage despite the COVID-19 pandemic with the help of innovative ideas and platforms.
South Korea has confirmed the first local case of the mysterious coronavirus from China.
마라톤을 뛰는데 한 10km 정도 오지 않았나? 근데 10km를 100m 달리기로 전력 질주하지 않았나 그런 생각이 듭니다. 앞으로는 좀 더 장기전에 대비해서
It has been 6 months since Korea's first case of COVID-19, and as the pandemic shows no sign of abating, authorities are now seeking a balance between reviving the economy and ensuring public safety. Now, this is no simple task, of course, and depends on variables that officials have little control over. For more on this, that is, I have Professor Lee Geun-hwa from Hanyang University. Welcome to the program, Professor Lee.
Hello, nice to meet you.
Good to meet you too. Yeah. And I also have Professor Lee Han-sung from Yonsei University. Good to see you again, Professor Lee.
Hello.
Professor Lee Geun-hwa, we'll start with you. Health authorities had earlier forecast that a second wave of COVID-19 would occur in the autumn or in the winter, but we are currently seeing an alarming rise in the number of infections worldwide. Is this the second wave?
Actually, we still don't know that about, and I'm not also know that, but we carefully look at the epic curve, the trend of epic curve, or the number of the confirmed case. If the epic curve trend is sharply increase, or the number of the confirmed cases increase, we are going to the second wave or second pandemic. So we're thinking about, we carefully look at the epic curve or the number of the confirmed case. So the number of the case, the number of the confirmed cases is one of the criteria of the second wave that decide.
I see. So we still have no idea then.
Yeah.
Professor Lee Han-sung, Korea for its part is seeking to tackle a rise in import cases as well as cluster infections here in the metropolitan region, with the more recent ones involving a nursing home and of course today's case on the frontline unit in Pocheon. How would you assess Korea's current situation?
Well, the current outbreaks and the influx of cases from overseas are inevitable since we decided to coexist with the coronavirus. And as long as we decide to keep on running the economy and open the borders, I think it's going to stay the same. I think most experts forecast that there's going to be a pandemic early in the fall, and it's going to be peaks and valleys in terms of cases and numbers until it's finally over.
I see. Okay, we'll take a moment now to learn about the results of a study in Spain that shed a grim light on hopes for herd immunity. I have the co-author of the study, Dr. Marina Poyan from Spain's National Center of Epidemiology. Welcome to the program, Dr. Poyan.
Hello, good morning.
Right, it's afternoon here, Dr. Poyan. Now, you conducted a study on more than 60,000 people in Spain and found a mere 5.2% had developed antibodies. Could you please tell us more about that study?
Well, the study is a population-based study that was conducted in 3 rounds. The overall seroprevalence was 5%, 5.2 in the third wave. But we found very huge geographical differences across the country. And I think that the study shows that herd immunity is difficult to achieve in the first wave of the epidemic.
I see. Professor Lee Geun-hwa, if you have any question you'd like to ask Dr. Poyan, please go ahead.
Okay, thank you very much, Dr. Marina. I have a question. Is up to now, the difference of the positive rate of the two antibody to SARS-CoV-2 is different from the country to country. And my question is, do you have any data or idea about the positive rate of the antibody to SARS-CoV-2 by age, region in your country, in Spain?
Okay, our study gave estimations of regarding sex and age. Because it's a huge study, we could provide seroprevalence rates for 5 age groups and differentiating also babies. That means children less than 12 months old. We didn't see huge differences in seroprevalence according to age. It's true that young children had lower seroprevalence, but in general, we didn't see an upward trend with age. And we didn't see differences according to sex. And the most important result for us were the huge differences in different areas of the country. The highest seroprevalence was seen in the middle of the country, around Madrid, that is the capital. There we had a seroprevalence of higher than 10, that was more than 5 times higher than the seroprevalence that we observe in the coast or in the Isles. So the epidemic wave has been very different in different areas of my country.
I see. Dr. Poyan, a similar study in Korea showed 0.03% of the people had antibodies. I suppose this finding also reflects negatively on hopes of herd immunity.
Yeah. Well, I didn't know that the seroprevalence in Korea was so low. Probably different tools to assess the percentage of people who had antibody can explain part of the differences. But I have heard, I am not very familiar with the situation in your country, sorry, but I heard that you had wide access to PCR testing during the pandemic, and that your way to approach the epidemic was to try to identify and test every single case that with every single person with symptoms, and you try to trace their contacts and to quarantine them. So yes. This means that you had slow the circulation of the virus in your country. We didn't have access to PCR testing. So we reserved testing for most serious diseases, for cases at hospitals. So we couldn't contain the epidemic as you did. So I think that the seroprevalence is reflecting this, that because the circulation of the virus was slower in your country, the percentage of people who have been infected is also smaller.
Right, Dr. Poyan, that is an interesting perspective. Now, Professor Lee Han-sung, if you have a question you'd like to ask Dr. Poyan, please go ahead.
Yes, Dr. Marina. I was wondering if there were any changes in your Spain's policy based on the findings of your study.
Okay, well, our study was started when we were under national lockdown, because, as you know, antibodies appears 2 weeks at least after the infection. We were more or less reflecting the situation during the lockdown. We have taken 3 rounds, so we have seen that the seroconversion rate was smaller between the second round to the third compared to the first to the second. So we think that this shows that the lockdown was effective in slowing down the circulation of the virus. Now, because we conducted the study because we didn't know the exact dimension of the pandemic, because we didn't have, we haven't identified, as I said, all cases in our country. So I think that now we have a more realistic picture of where the virus has been spread. Now, because the economic reasons, we cannot maintain the lockdown, but we are expecting to repeat the seroprevalence study in the fall to see how the situation has changed, and this would guide the measures the government is going to take for the pandemic.
I see, and hopefully the results then will be a bit more favorable. All right, Dr. Poyan, thank you very much for making the time to join us live at this hour with your thoughts.
Okay, thank you. It has been a pleasure. Bye-bye.
Right, Professor Lee Han-sung, over in the US now, the younger population account for a larger percentage of the new infections in recent weeks. What do you believe is the reason for this trend?
Well, I think there are many reasons. After the lockdown was lifted, many Americans began their social activities without wearing any masks, which probably led to a whole widespread of infections. And the younger population, while infected, they tend to remain asymptomatic, which probably contributed to the vicious cycle. And on top of that, maybe the main reason would be that the US increased their capacity to testing, and where there's more tests, the results of case detection is a little bit higher, I guess.
Which is understandable,
Yes.
of course. Professor Lee Geun-hwa, another disturbing trend in the US is that affecting young children, toddlers below the age of 2, with most of them below 1, that is. They tested positive for COVID-19 in one Texas county alone. And over in Brazil, we had fatalities involving infants. How do you explain this unsettling phenomenon?
Actually, we should do more study for understanding this event. But one thing is nowadays the SARS-CoV-2 variant in the spike region is rapidly become the predominant in the worldwide. Korea is also. So the characteristic of this virus is that the more transmission compared to the previously type. So that's why I think that the predominant type is changing, and they maybe contribute to the children. But we should do more study about this for understanding about this event.
And the strain you're talking about is the mutated one, the GH clade?
Yeah, GH. The mutation is the position is 614, and the amino acid change, the aspartic acid to the glycine. The amino acid change may be the transmission to human cell. So,
I see.
Yeah.
The change in amino acid that
Yeah.
has raised the possibility of infections around people.
Yeah, but we should do more study for understanding this event.
I see. The studies are still in their early stages then.
Yeah.
I see. Professor Lee Han-sung, authorities here, of course, are talking about how we need to prepare for a prolonged fight against this pandemic. What would be your words of advice to prepare the people here and, of course, across the world for a protracted affair, protracted battle against the pandemic?
I think there are 4 major factors that could affect us in the fall. First one is case management after vacation. It would be a daunting challenge for the authorities to track down all the cases after there has been a huge movement in population during the vacation. Second one is monitoring the situation overseas. There are a lot of countries that don't have the capacity to control their COVID case counts, and we need to constantly monitor which countries are sending people to our country to make sure they don't strain our public health system or exhaust our resources. The third one is early access to vaccines and antivirals. Since it's the US and other countries that are manufacturing those, and they're the ones a step closer to manufacturing those, we need to make steps to secure at least some amount of the antivirals and the vaccines to prepare for our second wave. The last one would be to carefully think about the implications of the flu season in 2020. With the current vaccination rate, I think, and the corona situation, it would probably complicate the public health system, and if we don't prepare for that, it's going to be close to a disaster in the fall.
I see. Professor Lee Geun-hwa, just out of curiosity, how far have we come in efforts to come up with a vaccine or cure against the virus? And do you expect such a vaccine or cure in the near future? Or are we looking at a year or 2 from now?
It is not easy to thinking about the development of vaccine, because you already mentioned that nowadays we have the mutation virus, mutant virus. So mutation virus means is the spike protein is changing. Change means usually the spike protein is a candidate of a target for the development of vaccine or therapeutic. So that's why we carefully thinking or considering the mutation of this virus in the spike protein, and then we are carefully look at this for more efficiency, the development of vaccine or therapeutic. Yeah.
I see. Professor Lee Han-sung, you mentioned the flu season coming up in the winter, of course, and you also talked about how quite a number of experts believe the second wave to be here in the autumn of winter. Do you also share these thoughts?
Yes, I do. Yeah.
And how can members of the public perhaps seek to ensure a better safety ahead of the season? Because it is coming up. We have the summer now.
Well, the vaccination rate for over 65 years old is close to 85%, but the younger population, it's close to around 30%. In the fall, when there's flu and coronavirus coexisting, it would be very difficult for us experts or the doctors to discriminate or distinguish who gets the flu and who is infected with the coronavirus. That would put an enormous strain on the hospitals and the health system in general. So I would recommend the people, especially in the younger age, probably get their flu shots
this season to make sure they go to the hospital, get their flu shots.
Exactly, yes. So we have one less thing to worry about.
Of course. Professor Lee Keun-hwa, just speaking from a layman's perspective, I was just wondering, if the virus itself is mutating at such a rapid pace, will the efforts right now to seek a cure be as effective? Yes, because we are trying to seek a vaccine or cure, and if this virus continues to mutate, will such efforts be effective in trying to treat that virus?
We should do keep the personal hygiene or such as the washing your hand, and then or keep the social distance is very important to the before after the development of the vaccine or therapeutic.
I see what you mean. Prevention is better than cure. Right, so make sure that you take efforts not to get sick while we wait for our medical experts to come up with a cure or vaccine. I see. All right, Professor Lee Keun-hwa, thank you very much for your thoughts. And Professor Lee Han-sung, as always, thank you for being with us today. Right, on that note, we end Wednesday's edition of COVID-19. Tomorrow, we address the impact of the pandemic on global food supplies. In the meantime, do reach out to us with your thoughts and inquiries on our social media accounts or homepage, arirang.com. Thank you for watching.